Hi everyone, and welcome to Webinar Wednesday. I'm your host Jessica King, and I just wanted to thank you quickly for joining us today. We hope you all had a very safe and happy Halloween last night, and no one's too upset about the Astros because we still have tonight, so go Stros. So November is Diabetes Awareness Month, and today we'll have family medicine physician Dr. Marjorie Broussard go over Diabetes 101 as well as some managing and prevention tips. And here's a little more info on today's speaker. So Dr. Broussard is board certified by the American Board of Family Medicine. Her clinical interests include management of chronic medical conditions like diabetes, high blood pressure, as well as obesity, preventive medicine, and women's health. She joined Kelsey-Seybold in July of 2015, which means that you just celebrated your 2-year anniversary with Kelsey, so congrats.
Thank you.
And she practices at the Cinco Ranch location. Don't forget that we'll be taking any questions you have at the end of the webinar. If a question happens to pop up, just type it into your question box and we will do our best to address it after Dr. Broussard's presentation. And now I'll hand it over to you, Dr. Broussard.
Thank you, Jessica. And today we are talking about diabetes. And when we talk about diabetes is a chronic disease that where the main issue is the body has no way to control or control poorly the amount of sugar in the blood. So where is this sugar coming from? Well, the food that we eat is converted in sugar by the digestive process. And then when that sugar gets to the bloodstream, then our body will sense that and it will release a hormone called insulin. And I like to explain to my patients sometimes that insulin is like little cars that will bring the blood sugar into the cells, so it will be a source of energy, which is, that sugar is a source of energy for our body. So that insulin is secreted by the pancreas, which is a gland that is in the abdomen. And like I said, we just need that insulin to be able to bring that sugar from the blood into the cells. If the sugar is not being brought into the cells, then it stays in the bloodstream. And if it stays in the bloodstream, then it could create problems. So when we're talking about diabetes, the problem is either the body doesn't produce the insulin, so we don't have those little cars to bring the blood sugar into the cells, or the insulin is just not working well, which is what we call insulin resistance. So what happens when we compare a healthy person with a diabetic person, like I was telling you guys about, with the food that we eat, through the digestion, that sugar comes out of the food and is brought into the cells by the insulin. And when that happens, the sugar goes down in the blood. In a diabetic person, that's in a healthy person. In a diabetic person, you eat the food is digested, the sugar starts going up in the bloodstream, and since the insulin is either not working well or it's just not there, then the blood sugar starts going up, the cells don't have that energy, so the person feels sick. So over time, that high level of sugar causes damage to organs, to the nervous system, to the kidneys, and then we're going to talk about other serious complications that happen when diabetes has been here for a while. So there are two main types of diabetes, and this is really important to understand what happens in each one because they are very different. Type 1 diabetes is the diabetes that happens when the body is not producing insulin. And in type 2, there is insulin, but the cells are not responding well to the insulin. So the insulin is not working well. In both of them, the result is going to be the same. The cells are not absorbing the sugar, so the sugar stays in the bloodstream. The damage is very similar. The symptoms are similar, but the the main root of the problem is definitely very different. So type 1 diabetes is usually diagnosed in children and young adults. It is not the most common one. It's only 10% of diabetic patients have type 1. It's also called juvenile onset diabetes, and it is the diabetes that happens when the pancreas is not producing insulin, and that is mainly due to an autoimmune destruction. That means that your own body destroys the pancreas cells that produce the insulin. These patients can only be treated with insulin, either insulin shots or insulin pump. Now, the type 2 diabetes is the most common type of diabetes. This 90% of diabetic patients that we see are going to have type 2. This is the adult onset. It means that it's usually diagnosed, after childhood. And usually the main problem here is insulin resistance. So the insulin is not working well. It is usually related to obesity. And there is also a significant genetic component to it. So family history of type 2 diabetes increases your risk for this type of diabetes. And there is also a racial predisposition. So certain races like African American, Hispanics, Native American, and Asian Pacific Islander are going to be at a slight increased risk to develop this type of diabetes. This type of diabetes is also associated to other metabolic problems like high cholesterol levels, high blood pressure, and it is also associated, like I said before, it is related to obesity. So patients that are overweight, obese, that have a sedentary lifestyle definitely have an increased risk for it. Now, you probably have heard about prediabetes, and what does that mean? And this is something that is usually related to type 2 diabetes. These are patients that have high levels of blood sugar, but the blood sugar is still not in the diabetic range. It's still not very high, but it's higher than normal. And it's usually what we consider early stages of diabetes. The body is having problems getting the blood sugar levels into a normal range. And what is important is that prediabetes is reversible. So we can actually do something about it. We can change it. We can fix it. Sometimes once we're diagnosed with diabetes, then it is a chronic disease, which means we cannot cure it, but we can control it. So if you are diagnosed with prediabetes, then it's very important you understand that you can actually change that condition with lifestyle changes, so those numbers will stay within normal range. Now, you might probably also have heard about gestational diabetes. And gestational diabetes is the type of diabetes that occurs during pregnancy. And it's most of the time, this is not a condition that the patients will remain diabetic after, but it is a risk factor there is a risk for developing diabetes in the future. So if you had gestational diabetes, you have to make sure that you are checked for that after delivery of your baby. And you can also develop diabetes in future pregnancies. So it is a risk factor, but doesn't necessarily mean that you stay a diabetic after you deliver your baby. So since we're talking about risk factors for diabetes, so what are some of those risk factors for diabetes? Some of them we can change. Some of them we can do something about it and just remove those risks. But some of them there's nothing we can do about it. Age is one that we cannot do anything about it. Patients over the age of 45 are at higher risk for diabetes. If you develop gestational diabetes or you had a baby that was over 9 pounds at the time of delivery, that's another risk factor, and we cannot change these risk factors. If you have family history for diabetes type 2, that's another risk factor that unfortunately we cannot do anything about it. Or your race, like we talked about, African Americans, Hispanics, Native Americans, or Asian Americans are at increased risk. But there are definitely certain things that you can change, and that is if you live a sedentary lifestyle. So if you are a person that usually is not very active, and by that I mean at least 30 minutes of aerobic activities at least 5 times a week, that could put you at risk for diabetes. If your body weight is above what your ideal body weight should be, or especially if you are obese, which means you have a body mass index over 30, then that is definitely a risk factor, and that's something that you can actually modify. And if you have pre-diabetes, then you have definitely an increased risk to develop diabetes later on in life. So again, that's another thing that you can change by making some changes in your lifestyle. Now, how do you know if you have diabetes? And I think the most important point that I will really want you guys to take home from this presentation is that early on in the disease, usually there is no symptoms at all. And that is why it's so important to go for routine checkups, which means you go see your doctor once a year and you get a checkup and you get blood work so you can find these kind of problems, because usually it will not give you symptoms early on. So it's usually diagnosed by screening. If your fasting blood sugar is less than 100, then that usually means you are normal. You don't have diabetes. You don't have pre-diabetes. If it's between 100 and 125, that's when we consider you a pre-diabetic. And if it's over 126 in 2 different occasions, then you are diagnosed with diabetes. So what are some of the symptoms? So later on in the disease, sometimes patients will present some symptoms, and some of them are frequent urination, increased thirst, or feeling a very dry mouth, being very hungry all the time, feeling very tired, weak. Sometimes when the disease is advanced, you can also have some weight loss, blurry vision, nausea, a slow healing of cuts or bruises, and tingling in your hands and your feet. So if you have any of these symptoms, it could mean you have diabetes and it is really out of control and it's been here for a while. So definitely will signal that you need to see your doctor right away. So what are the complications of having diabetes? So I was talking about, how the elevated blood sugar will cause damage to different organs. And some of the complications that we'll see at long term with diabetes are heart disease, heart attacks, strokes, blindness is the #1 cause of blindness in the United States. Kidney disease, again, the first cause of kidney failure and need for dialysis and kidney transplants in this country. It's due to diabetes. Infections that are usually severe, difficult to treat. Nervous system disease, this is nerve damage, what we call neuropathy. Blockage of the peripheral arteries, those blockages can cause amputations. Pregnancy complications, usually gestational diabetes or being a diabetic and then get pregnant will increase your risk of having some complications like preterm deliveries. Now, I said that diabetes is a chronic disease, which means we cannot cure, but we can definitely control and manage, sometimes even just with some changes in your lifestyle. So when we talk about how we're going to manage patients with diabetes, we definitely encourage patients to lose weight if body weight is a problem, especially if they are obese. I usually counsel my patients strongly on following a balanced diet, increase physical activity to try to achieve an ideal body weight. They need to eat healthier. That means that it is logic to think that if you have high blood sugar, then definitely you want to decrease the amount of sugar that you take in your diet. But it is also about, and we'll talk a little bit more about detail about it later on during the presentation, but it is also about making good choices with regards to your nutrition. It's not just cutting the sugar, the refined sugar, but it is also about adding some good nutrition to your diet. I definitely checking your blood sugar levels because, again, we talked about how diabetes can be asymptomatic, which means you feel perfectly fine, but your blood sugar might still be high. So it is important to know your number and keep your doctor's appointments. So usually with diabetic patients, we want to monitor their progress every 3 months or so because this is, again, a chronic disease that we need to just keep a close eye on, looking for complications, looking for worsening of the problems. So how do we lose the extra weight? If you're overweight, then we need to work on that. Diabetes sometimes makes, especially when it's poorly controlled, it makes it very difficult for patients to lose weight. So it is very important to address this very aggressively. Every pound you lose improves your health, and that is it's very powerful to just think that just by losing weight you can improve a serious disease like diabetes and high blood pressure and high cholesterol. There are several studies that have shown that patients that lose just a small amount of body weight, around 7% of initial body weight, and they exercise regularly, they decrease the risk of developing diabetes by almost 60%. So it is definitely a very powerful tool to just keep that weight close to the ideal body weight. And part of the weight loss program, and sometimes just part of the overall treatment for diabetes, is physical activity. So again, 30 minutes of physical activity 5 times a week is the standard recommendation. You can certainly do a little bit more than that, especially if you've been exercising for a while, but that is usually the main goal. Research and definitely has shown that both aerobic activities and resistance training, that means weightlifting, can help control diabetes. But the greater benefit comes from fitness programs that include both activities. That means having a combination of aerobic activity and resistance training definitely helps control your diabetes in a better way than just do it either one alone. So it not only helps you with your weight, it helps keep your blood sugar down, and it just helps your body use its own insulin. The more muscle mass you have, the less fat you have in your body, the better your own insulin will work. And that usually will help control your blood sugars. Now, eating healthier. Again, it's not just about cutting the sugar. It's about including healthy foods in your nutrition every day. More fiber, whole grains, reducing the fat because we don't want to increase the cardiovascular risk. And when we talked about eating more fiber, foods that have high fiber, some examples are fruits and veggies and beans and nuts. And the way they help is because the fiber blocks some of the absorption of the sugar in the digestive process. So it decreases your risk for diabetes because it improves the blood sugar levels. It also improves the cholesterol levels. So it definitely helps you lower your cardiovascular risk. And we just talked about how diabetic patients can have an increased risk for cardiovascular problems. So definitely having a high fiber diet will help. Usually patients that follow a high fiber diet have a better results when they're trying to lose weight as well. And it makes you feel full, but it doesn't. Usually these kind of foods will not have a lot of calories. So usually it will help you keep your weight under control. Whole grains, they again reduce your cardiovascular risk and decreasing your blood sugar and cholesterol levels. Grains come ready to eat, some bread, some pasta, and some cereals. You have to read your labels and definitely look for the word whole on the package, because you definitely you can have some bogus information sometimes. So read your labels, and if you are going to choose bread or pasta, try to go for whole grain instead of just the regular ones. Definitely decreasing the amount of fat that you eat, or I should say the bad fats that we eat, definitely helps decrease your cardiovascular risk. So you want to avoid the saturated fats and choose those lean cuts of meat, choose the low-fat dairy products, and go for the unsaturated fats in your oils, like olive oil. Definitely you want to eliminate trans fats from your diet. They increase the bad cholesterol, they decrease the good cholesterol, and these trans fats are not only on fried foods, but they are also on some processed foods. So it is very important, again, that you read your labels. Now, not all fats are bad. Some fats are good, and omega-3 fatty acids are good fats, and we do want to have a good intake of these fatty acids, omega-3 fatty acids, because they increase your good cholesterol, and your good cholesterol is a protective factor. Where do we find this omega-3? As you can see in that picture, on salmon, on walnuts, on almonds, you can find the omega-3 fatty acids. Other things that you can do to control your diabetes is, of course, through medications. And you should always take the medications as prescribed unless you are advised by your doctor not to. Don't skip your doctor's appointments. You should see your doctor at least every 3 months. Get involved in a diabetes management program. And we do have that through our clinic, where we have a certified diabetes educator and some dietitians and education classes. The more you know about the disease, the better chance you'll have to control it. And I do tell my patients, I want you to become an expert on the diabetes, so you can actually help me out manage your problems. Now, can we prevent diabetes? I definitely feel that it is possible. If you look at the risk factors and you see that, being overweight and be sedentary, it's a risk factors for diabetes, then eating better, being more active, then it makes sense that it will help you prevent diabetes. Or if you are pre-diabetic already, then you know now that you can actually revert that. Losing the weight, non-smoking, because smokers also, smoking is an independent risk factor for diabetes. And now we're going to have some time for questions.
Yes, and I am actually going to start us off with some questions. So we talked a lot about insulin and type 2 diabetics, and I know type 2 diabetics don't need insulin, but will they eventually need insulin?
Yes, that is a great question, because sometimes I get patients that would tell me, well, my mom has a type of diabetes, but she doesn't need insulin just yet. So if it sounds like insulin is like what we use when the diabetes is advanced. Again, diabetics type 1 will need insulin all the time. Diabetics type 2 usually will not require insulin because they still produce insulin, but sometimes when the blood sugars are really high and patients have severe symptoms, we definitely need to sometimes start insulin a little to control the blood sugar levels and avoid, serious complications. So it doesn't necessarily mean that it's the last resource. But yes, definitely sometimes diabetics type 2 will require insulin. And sometimes when they have been diabetics for a long time, their pancreas will pretty much burn out, especially if the diabetes is not being well controlled. And then they also will require insulin for treatment. Okay, and I have I'm reading some of the questions, and it is some of the question is it too much fruit bad if you're a borderline diabetic? I guess if you're a pre-diabetic. Okay, too much fruit, that could be bad because definitely there is sugar in fruit. It is natural sugar and is easily processed by the body, but too much of it could definitely make your blood sugars go up. It's also going to give you more calories, and if you're not burning those calories, then you are going to gain some weight, and gaining weight with prediabetes will make it worse. So too much fruit could be bad. You definitely want to balance your diet and have, a good healthy amount of fruit, but not too much of it. I see other questions. It is recommended to test your glucose daily if you have prediabetes. No, it is not usually recommended to test your blood sugar daily if you have prediabetes. Usually pre-diabetics, we don't use medications. We're not necessarily worried about bringing your blood sugars too low with the medications. Like sometimes that's one of the reasons why we tell our patients to check their blood sugars daily. So I don't think it is not recommended to check your blood sugars daily with prediabetes.
I have a question just going off of that one. If you are diabetic, how often should you check your blood sugar?
Very good. It usually depends on the type of treatment that you're getting for diabetes. If you are being treated with insulin, and especially if you've been treated with several shots of insulin a day, then usually you will have to check your blood sugars 3-4 times a day sometimes. If you are treated with just oral medications, then usually once a day will be enough.
Okay.
I usually also, and I guess an exception will be when my patients feel sick, or when my patients, and we usually educate them about symptoms of low blood sugar too. I usually will advise them to check it again, even if they already check it. If they're not feeling well, then they should check it another time to make sure.
Okay.
Let's see. I have a kind of a general question of, how often we should see the doctor when, and get the blood test. Usually we say every quarter, but when patients have been stable for a while, sometimes we can go twice a year just to avoid, sometimes just to avoid the burden of the blood drawn, or just to avoid cost. But definitely the standard recommendation is to check the hemoglobin A1C, which is the average of blood sugars every 3 months. I have questions about, I have gained weight by being on steroids. Will this also cause me to be concerned about diabetes? That's a very good question. And we didn't talk about, the type of diabetes that sometimes happens with medications like steroids. I would say that patients that are on steroids chronically, that means they take daily doses of steroids for a long time, they are definitely at increased risk of diabetes. These patients usually gain weight, but it's also because the steroids per se will increase the blood sugar. If you have been on steroids just temporary for a week, 2 weeks, then if you are not pre-diabetic, then you shouldn't be at increased risk for diabetes. But you do want to make sure that weight gets under control. So I would say let's get on that wagon of exercising and eating right to get the weight off of you, so you don't develop diabetes because of the weight issue. And I have another question here. How cigarette smoking can cause or contribute to diabetes? I don't understand the nicotine relationship to diabetes. I know. It was found on study. I definitely feel the problem with diabetes and smoking is not just the nicotine, but it is also, other chemicals. And I think that it doesn't necessarily mean that that all people that smoke will develop diabetes, but there is a relationship, and there's a study that showed that patients that people that smoke have an increased risk. So it's one more reason why we definitely should encourage patients to just stop smoking, because it's another risk, just like cancer and cardiovascular disease. So it is a risk factor, and I think it has to be with inflammation. And it's not just the nicotine, but other substances that we found in cigarettes. Very good. Once start taking insulin, can you get off of it? If you're a diabetic type 2, yes. If you've been treated with insulin because your blood sugars are temporarily too high, and things get under control, and you lose the weight, and you get your diet just right, then yes, there is a possibility that that you can get off the insulin. Now, if you're a diabetic type 1, which means you don't produce insulin, obviously you are going to need insulin for the rest of your life. Or if you've been a diabetic type 2 for a long time, and your pancreas is burned out and you don't produce a lot of insulin, then probably you are going to need that little insulin because your own body is not producing it anymore, or it doesn't produce enough of it. So I guess it could go both ways.
All right, I'm going to end us on one final question. So say you are just diagnosed with diabetes, what is the next step that you need to take in your life?
Very good. Well, the first step is to make sure that you are referred to a diabetes educator, a certified diabetes educator, and a certified dietitian, because you do want to learn as much as you can about the lifestyle changes that you want to take to control diabetes, because it is possible to control your diabetes with lifestyle changes. So, and definitely I would say the first step should be definitely you want to cut the refined sugar of your diet.
All right, so we are just past 12:30, so we're going to go ahead and end our presentation. I want to say thank you for y'all for joining us this month, and thank you so much to Dr. Broussard for all of the great info that she gave. This is going to conclude our webinar, but be sure to join us for our last webinar of 2017, which is going to be in December, How to Avoid Holiday Overeating, featuring a Kelsey-Seybold dietitian, Lisa Mook, and you can tune in to learn how you can eat smart and healthy during this holiday season. And don't forget to join us on social media and join in on the conversation. Thanks again for tuning in, and we'll talk to y'all next month. And go Astros!
Thank you.